Hey folks, Dr. Rob Jones here, heydrrob.com. So again, bringing another episode of Backbreaker of the Week to you. Have you ever been told your hamstrings are so tight it's hurting your lower back? Well, how about if I told you your hamstrings don't even attach to your low back? Your hamstrings attach to your sit bone right here. They have nothing to do with your low back. If they get tight, they may prevent you from getting into a hip hinge this way. But I can't tell you how many times I have people come in and say, hey, Dr. Rob, my hamstrings are so tight, I can't get them to loosen up. I need them to loosen up to make my back feel better. Well, let me tell you right now, it's probably not your hamstrings. It is going to be your glutes and your deep hip rotators. I want you to look these muscles up, okay? Your your quadratus femoris, your obturator internus, your gemellus superior inferior, your piriformis, your glute med, glute min, and glute max. Look those up. They will not allow the ball to spin in the socket if they get tight, and then they get locked up here, you can't hip hinge, now you gotta get into your hamstrings. You stretch the heck out of your hamstrings, and you don't make any improvement. So, I'm gonna show you with my good friend Lisa here. Okay, let's show everybody how tight your hammies are. So, go into a nice hip hinge. Lisa's had chronic back pain, so we've been working on fixing her. Now, are you at your limit right there? Okay, now push your knees back a little bit. You get a little bit more straightness out of your knees, okay? So we're limited to about right, even with your knees bent a little bit, we're limited to what we call that, maybe 6-8 inches above our ankle. Now, we're gonna stretch our hips out, and we're not even gonna stretch our hamstrings, and I want you to see what happens. So, go down into a quadruped for me, Lise. Okay, let's do that kneeling hip airplane. So let's take your leg behind you, swing that in, drop the back knee down, okay? Turn your belly button towards that hip that you're stretching, okay? Wait for a nice big stretch. Those deep hip rotators I was talking about. Quadratus femoris, obturator internus, gemellus inferior superior, piriformis, glute minimus, medius, maximus. Big stretch there. Okay, now we're gonna contract it, so push that left knee into the ground, take your belly button away, and pick yourself up. Now we're going into a contract, relax here. So that all those structures are contracting to pull her away. Now drop back into that stretch. Push that in. Search around for where the stretch is best. Hold it for about 3 seconds. Take it away. Drop it back in. Belly button to hip. Push that hip to the side. Push it back again. Sometimes we might need to bring it straight to the side. Sometimes we might need to go back this way a little bit. You gotta search around for where the stretch is best. Take it away. We're gonna do about 10 to 12 reps per side. Butt on fire yet? Take the hip away. Drop that hip in. Good. Let's get 2 more there, listen. Belly button to hip. Really feed that belly button towards that hip. Not twisting the spine. She's actually got a little intra-abdominal pressure going. Let's go one last one. In. Beautiful. Again, notice how there's no spinal twist at all. It's only hip motion. Open that back up. Good. Now let's go ahead and do the other side. So we're going to go right knee down. That leg's going to come back. If you got a little knee pain here, you can put a pad under your knee. So let's push that hip over. Obviously she's a little tight there. And again, you're gonna hunt around, search around for where the stretch is best. Maybe to the side, maybe back a little bit. Hold it for about a 3 or 4 count, contracting by pushing that right knee to the ground as you open it up. So open that up, show me the belly button. Perfect, drop it back in. Push, 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 push. And then each successive rep, what we're trying to do here is get a little more range, a little more range, a little more range, a little more range. And that's going to allow you to access that really good femur rotation inside the acetabulum, which is the hip joint, major ball and socket joint. Loosen these muscles up and have a really way easier time getting a hamstring stretch. So again, quadratus femoris, gemellus inferior, obturator internus, gemellus superior, piriformis, glute minimus, glute medius, glute max, all on major stretch right now. Open up for the contract phase. Turn it in for the relaxed phase. Let's get one more after this one. Turn it in, turn it in, turn it in, turn it in, turn it in. Open it up. Good, okay. Let's stand up and let's check your hamstrings. Okay, so nice hip hinge, lordosis. Let's get a little IAP. Go ahead and drop those arms down. And look at this, folks. She is basically, bring your hands a little bit more on your shin. There we go, look at this, she's touching her shoes. Lisa, push your knees back a little bit. Good, come back up. Let's go and do that one more time. All the way up. Keep your lordosis. Hip hinge back. Okay, slide your hands down go along your shin so we can see what you got. And there we go. So one set of hip rotation each side, she gained about 7 inches of range, and she didn't even stretch her hamstrings. Okay, so there you go. Was it your hamstrings? Probably not. Maybe it is, who knows? Okay, everybody's a little bit different, but I will tell you, I see this time and time again. People trying to stretch their hamstrings, trying to touch their toes, their back never gets better, their hamstrings never get better because they cannot access a good hip hinge because they're so stoved up through here. So again, let's focus on lordosis and intra-abdominal pressure, hip hinge. When we're actually doing this movement, again, we're gonna find where the stretch is best. Okay, Lisa was kind of coming back this way. For me, if I actually go inward and then I come a little bit more lateral, straight in that position, I get a monster stretch. Now I'm gonna really drive this downside knee into the ground, pick me up. I'm gonna pivot away, because right now all these structures are contracting in abduction to try to hold me up. Now the nervous system will allow them to relax a little bit more after they've contracted to get me a little bit more range. And I'm gonna search around for a little bit more, a little bit more, a little bit more. And I'm gonna push that knee to the ground and open up again. And lo and behold, one set, she gained that much hip flexibility. And imagine if you did that 2 or 3 sets a day over a week or two, imagine how flexible you're gonna be. So I hope you like that. Don't forget to subscribe, check me out on the socials. Hey Dr. Rob on Instagram, Facebook. And as always, don't forget to protect your back.